My name is Dr. Remolina. I'm a pulmonologist. I work out of Linden, New Jersey. I've been in practice for 30-some odd years, and our practice deals with a tremendous number of pulmonary issues, from asthma, bronchitis, pneumonia, pulmonary emphysema, sarcoidosis. But unfortunately, we see a tremendous number of patients that have cancer of the lung. You know, it's important to understand that cancer of the lung is a preventable disease. Most of the time, cancer of the lung is associated with smoking. Patients that smoke have the risk of developing lung cancer. We see a number of patients in our office, and the spectrum varies from patients that have localized tumors that we can do something about to patients that have diffuse metastatic disease that we can do very little about. Our office is equipped to do pulmonary function studies, and when appropriate, we can make diagnoses by doing bronchoscopies, with transbronchial biopsies, percutaneous needle biopsies, etc. It is important to understand that cancer of the lung, there's a number of different types of cells. The most common is adenocarcinoma of the lung, which is usually a peripheral mass that presents in patients that smoke. Some patients don't smoke, and also can present with metastatic disease very early. In fact, we have seen a number of patients that present with seizures, and when we study them, we find out that they have a tumor in the lung that has spread to the brain. This type of tumor we diagnose by doing most of the time fiber optic bronchoscopies or transbronchial biopsies. When appropriate, the patient will be referred to either an oncologist when there is a metastasis, or if it's a localized lesion, we will refer to surgeons that do surgery called VATS, video assisted thoracic surgery, which is a minimally invasive procedure that with 3 little openings we can go into the lung itself and take out the tumor. There's other types of tumors. The squamous cell carcinoma is also well known as patients that smoke, and also presents with large localized tumors. Sometimes we're lucky enough to make the diagnosis, and this one's a little early. Other tumors are large cell carcinomas, but the dreaded tumor is the small cell carcinoma or oat cell carcinoma. These tumors are very small, and on diagnosis we assume that these tumors are already metastasized. The reason being is that the cells are very, very tiny and they spread very quickly. Those patients, when we make a diagnosis, we refer them to an oncologist, and we deal with a number of oncologists in the area. The oncologists usually treat these patients with chemotherapy. Chemotherapeutic agents usually are successful in controlling the tumor at first, but usually the tumor comes back with a vengeance in a short period of time. So therefore, if you smoke, please think about what you're doing to yourself. We are very serious in this office about treating patients, and we're very serious about making our patients stop smoking. Unfortunately, that's a task, and it's very difficult to get those patients to stop smoking. But if you smoke, do yourself a favor, stop smoking. It is important to understand that there is a lot of other things that you can do, and if you're interested in learning more about cancer of the lung as well as other respiratory ailments, please make sure to check our links so that you can learn more about this deadly disease. Thank you so much.